We've been using the product since January of 2002. We were one of the first primary care practices to choose electronic medical records. And one of the best things about working with HST is the communication and the responsiveness. One of the major advantages, you're not just buying one version of one program and you're kind of stuck with this EMR unless you want to can it and buy some other EMR. We're part of an evolving process. We get updates, we pay a maintenance fee, but basically we never have to buy a new product. We always have the latest update, the latest advances of the program. So I think that's been one of the major advantages of the program. The other major advantage from my standpoint as a primary care physician, I think the program's built from the bottom up. It starts from the physician in the room with the patient and what our needs are, whereas my experience personally and vicariously through other physicians who've worked for our practice, who've come from working with some of the larger national electronic medical records, where the outpatient package just seems to be like an add-on to the whole system's EMR and not being very responsive to the needs of what we do. Starting out early in 2002 with an EMR company, you kind of always worried in the back of the mind, will the company be there next year? Because it was a very changeable market. Companies would come and go. So it's nice. We have 10 years experience, a lot of confidence that the company is successful in ongoing endeavor. And we've always felt positive about our interactions there. There's never been an issue that we couldn't fix or resolve. So we feel that they're a good professional company, and you can always get them on the phone. As you know, computers aren't perfect and EMRs aren't perfect, and there are times when there are issues that come up, either software or hardware, or sometimes you don't know whether you're software or hardware. And you really need to have access to professionals that can help you on the fly to get these things fixed. We have a high volume practice. We need to keep things going, and we can't be shut down because of a problem. So we've always had good experience that we can contact them on the fly, and they've been helpful in resolving issues as they come up. I think probably the best thing about the program is that there's a great deal of flexibility on how the physician or provider uses it. In our practice of 8 providers, everyone uses the program a little bit differently based on their skill set and their experience, and so that gives them all a different comfort level. Some physicians for documentation will mostly use buttons and checklists and things like that. We'll use a lot of text macros. Others feel more comfortable typing, so they end up typing a lot of information in the EMR, and that's okay. Some doctors can't type, and they can use voice recognition. So there's a flexibility there that whatever skill set, and we've had doctors, among our 8 doctors, they've ranged from being pretty sophisticated with computers to having no experience with computers, and yet you need to bring them all on board. And I think the program has the flexibility to do that. As far as training new physicians, first of all, we've had physicians join our practice from other electronic medical records, including some of the major national EMRs, and all of them have felt that our medical record was superior, that it was more intuitive, it was more kind of in the flow of how we do things. So training has not been a huge issue. One of the main advantages of an electronic record is it allows you to gather information and it allows you to communicate information in a timely fashion and in a complete fashion. Our consultants always compliment us on the quality, the quantity, the accuracy, and the timeliness of the information that we provide for them before they see our patients. And I think that means that our patients get better care because the consultants can really focus on what they need to think about rather than just figuring out what's the problem at hand. The documentation in the EMR is good and it's extensive. As far as its effect on us financially, I think because the documentation is so good, I think we've had confidence to bill for complex visits, extended visits when it's appropriate, and we know that the documentation is there. Also, because a lot of the documentation is there right there at the time the visit ends. If I send a patient to the emergency room, I'll frequently send them with an entire note that's already completed and with a basic summary of their medical problems that goes with them in the ambulance. And that really helps facilitate things at the hospital. As a primary care office, we have 13,000 patients, and we may only see 150 of them in a day, but many of them, maybe 500 or 1,000, are doing something in the medical world, having a blood test, seeing a consultant, having an x-ray, having a study. We get a fax for every one of those things. In the time before EMRs, it was just a nightmare. It was always finding charts. We had 2 full-time employees just to find charts, to find the information. And sometimes there were times you couldn't find the chart. So probably one of the main values of the EMR is it brings in this incredibly large amount of medical information, and it focuses it, organizes it, and it gets it where it needs to be. Not only for us to see, but then for us to export and to transfer to what other physicians or hospitals that are involved in our patients' care. Before we had an EMR, we were using a transcriptionist, and we had 2 full-time transcriptionists. And we don't need to have those employees. You'd used to dictate your notes. It would then go with a wait time to the secretary to be transcribed. You'd then have to get all those charts back, and then you'd have to review all of those again, and then you'd have to sign them. This way, you do the note, and it's done. No, we can never go back to paper charts. I think the world is such that the amount of information we get is just overwhelming. In addition, at a time when it's been extremely hard for primary care practices to recruit quality primary care doctors because of the shortage of primary care doctors, it's been very easy for us to recruit excellent physicians, and having a good quality electronic medical record is a huge plus in recruiting new physicians. I've had some experience with other EMRs through my colleagues, particularly the large national products. And in general, there's been a higher level of frustration and dissatisfaction, and particularly they're surprised when they hear from me that I can customize it, that I can say, I would like the EMR to do this. It does not do this. I can make this suggestion to the company, and chances are in the next version that comes out 3 to 6 months later, the new suggestion is there and is valuable to everyone. And the program benefits from not only my suggestions, but from suggestions that all the other doctors who are using the program, the ideas that they come up with. Right. We have access to the medical records from home or any place we are with our laptop computer. So whereas it used to be on call, sometimes you'd wing it where you don't really know very much about the patient. You're trying to make decisions on incomplete information, or you're sending them to the hospital not knowing very much about what's wrong. Now we can dial in from wherever we happen to be, get all the information, see the chart, make more educated decisions, and it just makes the quality of care much better. It allows us to document our after-hour services very quickly in the chart, so it all gets done. It's all well documented. I think there's obviously huge medical, legal advantages to having a good quality electronic medical record.